Hello, this is Anna White, and I did my professional nursing project current issue on C. diff. Is C. diff? C. diff is a short way of saying Clostridium difficile colitis, which is a bacteria that can cause terrible pain and inflammation in the colon. Almost always affects older people in hospitals or long-term facilities and usually after antibiotics, but not always. About 500,000 people a year get sick from C. diff. People even die from C. diff. Some people, they carry around the bacteria in their gut but have no symptoms but can still be contagious. The community that I am doing my project on is Salina Regional Health Center. It's a hospital of about 140 beds, and the project that I did is actually on one floor, the fifth floor. There's 40 patient beds on that fifth floor. The whole hospital, it's a trauma center, level 3, but acts as a level 2. There is a lot of new nurses on the fifth floor, and a lot of them, they're called Evant nurses, and they are contracted for 5 years, and they're all from different countries. So there is quite a bit of language barrier for the patient and for the nurse and nurse to nurse. This just happened about a year ago. We don't take traveling nurses, but they just started this new Avant nurse thing. And they can only work nights, so it's been very different. The other nurses we have, there are very few that have been there more than 5 years. Most of them are newly graduated nurses that we have, but some of them have experience. It's also a non-profit organization. Here's just a little example over here about what C. diff can do to the gut after exposure and all that. It just shows the inflammation mainly. So what causes the C. diff bacteria? It is everywhere, but most commonly people get it from antibiotics. Because the antibiotics get rid of all the good bacteria, and it overloads the gut with C. diff toxins that cause it to become inflamed. And then when the person has C. diff and then they poop, if the poop gets on the food or it's not properly cleaned, then it'll be transferred to other people. C. diff is the gram-positive bacteria, and it can only be cleaned and taken care of with Clorox or soap and water. It cannot be taken care of by sanitizer or anything else. The culture of this community at 5 Surgical, Salina Regional Health Center, they range from just a couple of days old to like over 100 years old, and all socioeconomic diversities. It's a med-surg floor, but it's also a pediatric floor, trauma floor. We take almost every type of person. When people come and they are already positive for C. diff, we automatically put them in contact isolation, which is a gown, gloves, and then they have to wash their hands with soap and water before going in and after coming out, everybody. Also, we try to require it for visitors to be gowned up, and we educate them about it as well. If they test positive after they've already been there, then we do the same thing. The issue is obviously C. diff infection rates at this facility on 5 Surgical especially. They have been extremely high in the past month. Based on hospitalsafetygrade.org, it is at a grade C with a score of 1.093. The worst score is 1.94 and the best score is 0. The average for hospitals nationwide is 0.751, so ours is a little high. We are definitely taking steps to fix the outbreak. I am on the C. diff committee, and we meet once every 3 months, and we talk about different ways that we can help the facility decrease C. diff infection rates and different things like that. So I think every time we meet, it's very effective. How can you prevent it? I kind of mentioned before, you have to use soap and water. You cannot use hand sanitizer. Also, everybody needs to use the proper PPE, contact precautions for sure, which is a gown and gloves. Don't use antibiotics unless necessary. Clean the room with bleach and clean everything in the room with bleach. Also, obviously, educate the visitors on what they can do. Educate the staff to not use sanitizer, how important it is to use soap and water. It's something that can be prevented and needs to be prevented. There's a little fact sheet I found about C. diff. It just shows like the impact, the risk, how easy it's spread, and how to prevent it. You can find that on cdc.com. At Salina Regional, the staff and the visitors, they're required to be educated on C. diff and how to prevent it. I feel like most of the time, visitors that come, they just aren't properly educated, and so they don't know how to prevent it. So we've actually printed off a fact sheet like this, and we give it to the patient and the visitor so that they can understand what it is and what we're doing to prevent it and how important it is. Risk factors for C. diff can be, like I said before, antibiotics, being in hospitals often because it's just that environment. Age, actually, and having a GI surgery, weakened immune system, kidney or liver disease, or taking PPIs. So if we take care of this, obviously there's going to be fewer deaths and shorter hospital stays and less expenses. If you have C. diff, you're going to be in the hospital longer because then they're going to have to give you something to get rid of it. Early recognition of the symptoms and putting in isolation is very, very, very important. We actually do a PCR testing rather than a toxin testing, and it comes back in 90 minutes. It's amazing. So everybody should be doing that so that it's way faster. Using the sporicidal disinfectants in patients' rooms and on equipment. Having visitors and staff using the contact precautions, and then terminal cleaning of room at discharge with the proper bleach wipes, and then using a UV light as an additional step can really help minimize the C. diff transmission. Recommendations that I would make is obviously using the UV light. There are so many research education out there that you can find showing that the UV lights drastically reduces C. diff infection. Doctors need to be educated. Staff needs to be educated about washing their hands with soap and water before and after every patient. So important. A lot of times doctors don't understand the importance or don't care. They have to be educated. Using your stethoscope in there, you need to wash it off with bleach or use one that's already in there. Such as other medical equipment, computers, everything like that. They need to be cleaned with bleach in between uses. Keep the positive patients that are positive for C. diff on isolation contact. Even if they don't have it throughout the stay, continue them on contact isolation until they leave the hospital. Make sure that the staff and the visitors are wearing gowns and gloves, and mainly it's just education. As long as people know how to take care of this and will be educated about it, then they'll probably do it. The references that I used, and I hope you guys enjoyed.